We continue to see a rise in COVID cases across the state. In the last day, there were over 4,300 new cases reported and 8 more people died. So we're still seeing a significant rise in hospitalizations with over 500 in the hospital across the state. The state health department says the majority of those in the hospital are not vaccinated. But despite surging COVID cases, the Centers for Disease Control is shortening the recommended time for isolation for people with COVID-19. Well, that change is motivated by new science. Here's Paul Dudley.
The CDC is changing the guidance on how long people should isolate after testing positive for COVID-19, saying people with the virus are most infectious in the 2 days before and 3 days after symptoms develop. That's why the CDC is cutting the isolation time from 10 days down to 5 days. If you have symptoms at the end of the initial 5 days, the CDC says to stay home until you feel better. At the end of the 5 days, if you have no symptoms, you can return to normal activities, but wear a mask for the next 5 days.
If you have no symptoms or your symptoms are resolving after 5 days, you can leave your house, but with the caveat that you need to continue to wear a mask around others for 5 additional days. We know that mask wearing greatly decreases the transmission of this virus to others.
Now, this is for people who are actually infected, but there are also new rules for when you come into close contact with someone with COVID and are not infected. Now, if you're boosted with the vaccine, you can skip quarantine if you wear a mask in all settings for at least 10 days. If you're not boosted, you should quarantine for 5 days and see if any symptoms pop up. We asked Dr. Fred Lopez with LSU Health for his take on the change.
I think it's good. I think it's an effort to keep up with the science. It's also an effort to not stall society.
Now, the CDC says prevention is still the best option and says all eligible people should get vaccinated, boosted, and wear a mask in indoor settings in areas of high transmission, as well as test before you gather. And one final note here, isolation is for when people actually test positive. Quarantine is for when you come into close contact with someone with the virus.